Welcome to this week's edition of Ask an MS Expert. I'm Jon Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Currently, I'm a member of the International Progressive MS Alliance Scientific Steering Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. Thank you and welcome to all of you who are joining us on GoToWebinar, Facebook Live, YouTube Live, and Twitch. This MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions in the GoToWebinar chat box. MS navigators are online throughout today's program, answering questions and connecting you with resources. As we get started, I'd like to acknowledge and thank today's premier national sponsor, EMD Serono. Support from MS community partners helps the MS Society reach its goal of providing up-to-date information and support through programs like Ask an MS Expert. Rehabilitation is an important component of comprehensive MS care. From the time of diagnosis onward, rehabilitation specialists can provide education and strategies designed to promote your health and wellness, reduce fatigue, and help you maintain optimal physical function. And when you think about maintaining optimal physical function, mobility is often at the top of that list. Today, we're talking about mobility intervention strategies for those people experiencing minimal walking or gait difficulties, as well as those of you who are dealing with more advanced walking or gait difficulties. We're being joined today by two experts in the field of MS rehabilitation. I want to mention that both of our guests will be speaking at the upcoming 11th International Symposium on Gait and Balance in MS, a conference that's focused on mild and severe MS-related mobility disability, so we're especially glad that they could take time to join us today. Dr. Herb Karpatkin is board certified in neurology and geriatrics through the American Physical Therapy Association. And Herb is also a certified multiple sclerosis clinical specialist through the Consortium of MS Centers. In addition to being actively involved in patient care, Herb is a tenured associate professor of physical therapy at Hunter College, City University of New York. His primary areas of research are aimed at understanding and developing interventions that result in improved mobility for people living with MS. And before we meet Herb, I'd like to introduce Cinda Hugo, a physical therapist and MS researcher at Oregon Health and Science University and the VA Portland Healthcare System. Cinda has over 25 years experience as a physical therapist specializing in MS. And for the past 10 years, Cinda's focused on developing her research expertise, receiving awards for research presentations at both the Consortium of MS Centers annual meeting and at ECTRIMS, which is the largest MS research conference in the world. Welcome, Cinda, and thanks for joining us today.
Thank you, Jon, and thank you for inviting me to join you today.
Someone newly diagnosed with MS is probably not thinking about mobility interventions. Can you tell us why it's important to address changes or difficulties with gait early on?
I think it's important to address problems when they arise. If we can prevent something, it's even better, but if we can get on top of it as soon as we recognize that there might be a problem, I think the outcomes are much better. And I think in a disease like MS, which has the potential to be constantly changing, it orients people to awareness, to changes in their personal situation that maybe they should get on top of.
If someone ignores the signs of walking difficulty and chooses not to seek treatment, does that decision have any effect on their future mobility?
Well, that's a really good question, John, and we really don't know the answer to that. But we do know that any kind of walking problem puts people at risk for falls. And we do know that falls have serious consequences in people with MS. They might be mild consequences from bumps, bruises, and scrapes, but they might also be serious consequences of fractures, head injuries, or even death. So I think it's important to not ignore any early walking problems. And of course, the easiest ones to ignore are the ones that kind of come and go. They're not there all the time, but you notice them once in a while. So it seems like they came and they went away, and let's hope they're gone away for good, but maybe they're not.
Well, I want to circle back with you on falls in just a couple of minutes, but I want to start by talking about fatigue. It's maybe the most common symptom of MS. About 80% of the people living with MS experience fatigue. First, how would you describe MS-related fatigue?
Well, MS-related fatigue has a variety of different types. One of the types of MS fatigue is what we call nerve fiber fatigue. This is an example of this is someone who might be walking for a few minutes and doing fine, and then after they've been walking for a while, maybe only a few minutes or maybe longer, 15 or say 30 minutes, and they start noticing that their walking is changing. Their foot might be slapping the floor, they might catch their toes a couple times, might just notice that they're slowing down, but they notice that something is changing. And this happens because the nerve signal transmissions slow down. They might be okay for a while, but then they slow down and the nerve signals just don't get there quickly enough for the muscles to respond in their normal manner. Another type of MS fatigue is related to other problems. You can have fatigue from depression, fatigue from other medical conditions that aren't treated. You might have fatigue from some of the medications that you're on for other medical conditions. So it's important to always make sure that you're on the appropriate medications, that everything is correctly diagnosed, and to review your medications regularly with your physicians. But then there's the final type of fatigue, which is the overwhelming fatigue that is often called lassitude. And this is the fatigue that's left over after all those other MS fatigues are optimally managed. And we manage this fatigue with prioritizing activities, graded exercise programs, energy conservation strategies, behavioral cognitive therapy strategies, among other things.
Spasticity is also common in MS. It can be as mild as a feeling of muscle tightness, or it may be so severe that it produces painful spasms. How can someone determine whether they're experiencing spasticity, especially if it's that mild version?
Well, you're right that the early on spasticity is it kind of sneaks up on you, and it might just be a little bit more stiffness. People might notice that they're stiffer than they used to be after prolonged immobility, for instance, after a long car ride or when they first get up in the morning. There are other signs of spasticity, and that can be muscles jumping. They could have a foot that is bouncing if it's in a particular position. They might notice spontaneous muscle spasms or cramps, and they might notice that a leg might draw up or might go out tight and straight. But early on, the most typical problem is probably that stiffness that just feels annoying and then just gets a little bit worse and worse.
How does spasticity affect someone's walking or gait?
Spasticity interferes with the normal coordinated activation of the muscles. Normally, muscles on one side of the joint work while the muscles on the other side of the joint are quiet, and that's part of that coordinated activity. In spasticity, the muscles are getting involuntary stimulation to work all the time. So you can get muscles on both sides of the joint trying to work at the same time, or you can just get an overstimulation of muscles on one side of the joint, and both result in that incoordinated, asynchronous movement.
So how can spasticity best be managed in MS?
Well, the cornerstone treatment for spasticity management is stretching. So spasticity is normally when muscles work when we ask them to. When spasticity is present, the muscles are working all the time. They're getting stimulation, involuntary stimulation to work all the time. Muscles work by shortening. We're able to lift something because muscles shorten. We're able to push a refrigerator into the wall because muscles shorten. With spasticity, those muscles are getting that stimulation to work or shorten all the time. So empirically, it makes sense to apply the opposite stimulation of muscle stretching. So we teach stretching to try to counteract that shortening or that shortening stimulation that spasticity causes.
I'm sorry, go right ahead.
Go ahead.
No, please continue.
And unfortunately, there is very little information on the benefit of stretching. So stretching, there's not much known in MS or spinal cord injury or stroke or cerebral palsy. Probably the best evidence for stretching for spasticity is the result of my pilot study looking at stretching for MS spasticity. And I'm now studying that program in 200 people with MS and spasticity to see if stretching is beneficial for the time and energy consumptive activity of daily stretching.
Well, we're going to have to circle back with you and find out more about that as you get further into that particular study. Many people experience visual disturbances as their very first symptom of MS, and vision issues may affect walking. Can you describe the vision issues that someone with MS might experience and how these kinds of issues might impact their gait?
Well, people with MS have a variety of vision issues. They can have blurry vision, they can have double vision, they can have vision that jumps. In particular, if they look far to one side, they might have, their vision might be bouncing a little bit, and that throws off your orientation in space. For balance, vision is one of the key systems for balance. There's the vestibular system, and which is the master system that sorts out any discrepancies, but it's kind of a slow system. There's also the somatosensory system, which is information from our feet and ankles that tells us what the surface is like that we're walking on that might be causing a disturbance. That's a very quick response. That's a reflex response. So it's the fastest one. But vision is, people with MS tend to become visually dependent. And you might know if you're visually dependent if you find yourself watching your feet when you're walking on a regular basis or most of the time. And unfortunately, people with MS can become too visually dependent. They can learn to not be so visually dependent, but usually it takes some time with a therapist working on what we call vestibular rehabilitation, which would work on all those systems to find out what that person has available to them. Do they have the vestibular system available? Do they have the somatosensory system available? And do they really need to be that dependent on vision, or could they rely on some of their other senses?
Can rehabilitation help with these MS-related vision symptoms?
Yes, it can. As I just mentioned in the vestibular rehabilitation, it can help train people to use systems that they've sort of learned to ignore that may still be available for them to utilize that are actually better and more responsive than the visual system. In terms of the double vision and the jumping or bouncing vision, the jumping and bouncing vision is challenging to change, but double vision can be corrected with different kinds of lenses.
Well, I promised that we'd circle back to falls. So Let's talk about fall prevention, because we heard from Johnny He wrote in saying that he hasn't fallen and landed on the floor yet, but a couple of times he's tripped and he would have fallen if there hadn't been a wall or another person nearby. Now, Johnny says that he's heard that falls can cause severe problems in older adults, but he's only 36 and he thinks he's too young to be dealing with that. It's making him nervous. Do we know why this might be happening, Cinda?
Well, it sounds like Johnny may have a condition called foot drop, where again, sort of that nerve fiber fatigue, where the muscles are there, but they're just not getting the information through the central nervous system. They're getting short-circuited in the central nervous system and not able to get to the peripheral nervous system and then get to the muscles to activate. So foot drop is a very common symptom in people with MS and can be an early symptom, and it can occur in younger people. It's not, and yes, at 36, he's certainly not an older adult. But there are several things that therapists do to treat that, and sometimes they will recommend a cane, which is a third point of contact with the ground. Sometimes they'll recommend an ankle foot orthosis, which will help hold the foot up in the swing phase so that it's not getting caught on the ground. And both of those are compensations. The other option that therapists have is functional electrical stimulation. And functional electrical stimulation is the best option that we have to actually replace function. It helps the muscles work in the synchronous, coordinated fashion, doing the activities that they're meant to do, and helping to keep that person safe and active and functioning in the activities that are important to them.
Weakness in leg muscles can lead to changing your normal walk stride. Now, Charlotte wrote in saying that she's had lower back pain for years and no one's been able to find a reason or a way to fix it. And since being diagnosed with MS, Charlotte's lower back pain seems to be worse and comes on more frequently. Recently, she's noticed that her walking seems to have changed. She's a little slower and a little less coordinated. Can Charlotte's back pain be related to MS?
It certainly can. It can be, any walking changes are going to affect sort of up the chain, as we say, and the back is one of those places that can be affected. If your walking has changed so that you're swinging your leg out to the side to clear your foot, or you're lifting your knee and foot higher than normal to clear your foot, or if your knee is hyperextending in the stance phase, all of those changes are reflected in and impact the back. And so, yes, it's very possible that those changes could be related to MS. And they could have been there before she was diagnosed with MS, which might be, if she has a long history of back pain, that might even predate her MS. But certainly if she's having more walking problems and they're coming on more frequently and her back is more and more aggravated, I think it's important to treat her walking problems and then evaluate what's going on with her back pain in addition to what's going on with her walking problems.
Maybe related to what you just said, can MS-related pain be effectively treated with medication?
It can, but it is recommended to treat pain with exercise. Exercise can be preventative as well as rehabilitative, and without the side effects of medications. Generally, the side effect of exercise is that you get improved fitness, and the side effect of medications can be very problematic, especially as we get into stronger and stronger medications. And medications don't really make pain go away, they lessen the pain. And treating the real cause is much more likely option to make that pain go away.
I think that the tricky part there is someone who's experiencing MS-related pain might be hesitant to start physical therapy or begin an exercise plan because they think it's going to add to their pain. What's your advice there?
That is a very, very typical response. And I think they they need to trust in their healthcare providers and trust in their own body and get an appropriate evaluation from their physician and from therapists, if that's appropriate, to evaluate what's going on and what the actual treatment needs to be. And then basically start low and go slow, but keep going.
We heard from Macy, and she says that she really hates the thought of having to use something everyone can see and everyone will know that she's experiencing mobility issues. Are canes and walkers Macy's only options?
Absolutely not. Canes and walkers are often first choices, and often people inherit them from well-meaning family members and friends, and so they're readily available, or you can walk into any pharmacy and pick one up, so they're readily available, but they are by no means the only option. As I mentioned, there are the ankle foot orthoses that are other options, but the option that I think is vastly underutilized that actually replaces function is functional electrical stimulation. MS affects the nerves in the central nervous system, in the brain and the spinal cord, and functional electrical stimulation stimulates the peripheral nerve. So it's stimulating the nerves that go to those muscles that are outside the central nervous system. Those peripheral nerves and those muscles are just fine. The problem is they're not getting the messages because of the short circuits in the central nervous system. So stimulating that nerve outside the central nervous system to get the muscles to respond in the normal way, I think is a great option for people to keep them active and doing the things that are important to them.
Well, we've heard from Ted, who says he likes hiking and running on single track trails. And he's wondering whether there are mobility aids for people with MS who want to continue being active outdoors.
Again, I think FES is a great option. It would, and the hiking poles and trekking poles, a lot of people like those, especially for outdoor activities like uneven surfaces, but they're also great outdoors around the community. You'll see more and more people using them for just daily walking exercise, and they don't have any mobility problems. They just find that they facilitate better posture, they facilitate more erect walking and more efficient walking. So the trekking poles are an option, but if they're having MS-related walking problems, the functional electrical stimulation, also known as FES, is another option to consider.
Who should someone be talking to about the best mobility-related options for them?
Well, they should certainly talk to their doctor, and then their doctor ideally would make a referral to a physical therapist. If they don't, then the person should certainly request a referral to a physical therapist, because therapists are going to be the ones who will systematically go through the various options for walking problems and help that person select the one that's going to be best for them.
Well, thank you, Cinda. Before we continue our discussion, I'd like to take a moment to welcome those of you who have continued to join us. Please let us know what's on your mind. Type your questions into the question or chat box on GoToWebinar. MS navigators are online throughout today's program, answering your questions and connecting you to resources. Our Ask an MS Expert program takes place at this same time every Friday. So please help us make sure that everyone knows about it by sharing news about the webcast with your family and your friends. And now I'd like to invite Dr. Herb Karpatkin to join me. Welcome, Herb, and thanks for being with us today.
Hello, John, and thank you very much for having me here. I'm glad to be here.
Enhancing a person's ability to be mobile and to be mobile comfortably and safely is important, not only because advanced gait difficulties can increase your risk of injuries, but the time required to recover from things like broken bones or sprained muscles can actually worsen mobility problems and reduce someone's independence. I guess to begin our conversation, Herb, when we talk about advanced MS, what does that mean?
That's really a great question. There's a sort of a classical definition, which means that this is a person who is probably walking minimally, if at all. They're not using walking as a primary means of getting from one place to the other. Walking may have some exercise function for them, but it's not functional. This is not to say that persons who are at that state can't improve their walking if they're not getting the right therapy or the right medication, but advanced MS generally refers to persons whose mobility has been profoundly affected by the disease.
Physical therapy to treat and manage advanced gait issues might look different than some of the things that Cinda just described. What might a physical therapy evaluation look like for someone with advanced gait difficulties?
That's really the million-dollar question. And like many questions to physical therapists, the answer is it depends. The real question is how has the MS individually affected that person? I don't think it affects any two people the same way. So it's the job of the PT to evaluate how has the MS affected their strength, their flexibility, their sensation, and in what manner has that affected their mobility. Mobility can mean walking, it could just mean sitting balance, but everything needs to be looked at. And then the question for me becomes, and I'm still actively seeing patients, are any of these findings on the evaluation in any way reversible? So very often patients who present with fairly profound gait difficulties with aggressive therapy can improve their walking. Not always, but it doesn't, the person with MS shouldn't think, well, my MS is advanced and therefore therapy can't help me. Nothing could be further from the truth. There's always a way of trying to improve mobility for that person, regardless of the severity of the disease.
Are there specific treatment techniques for people with advanced MS?
Specific treatment, well, once again, John, I hate to say it, it depends. It depends on how advanced they are. If somebody comes up to me and they say, well, I haven't gotten out of my wheelchair in a very long time, I'm going to wonder if their trunk is weak. So I may just try to sit them on the mat and see if they can support themselves without the use of a backrest. If there is some strength in their legs, but they say they haven't walked in a while, I may try to stand the person up to see if there's function in their legs that comes out as a result of them standing and bearing weight through them. So the techniques that you're talking about are going to be to try to see what the person can do if you give them the opportunity. The technique for a patient that I'm going to be discussing at the MS meeting you mentioned earlier today, I'm going to talk about a patient who hadn't walked in a while, but after a fair amount of physical therapy, including lots of time standing, lots of practicing the parallel bars, she was able to resume walking, albeit with braces and a walker. But the impact of this is that a lot of times the MS patient thinks they may be in worse shape than they are. And without really investigating the options that therapy can give them, they may not realize how much they're capable of doing.
I know that setting goals for a physical therapy program is important. How do you go about developing goals with someone whose MS is progressing?
Please don't shoot me, but again, it depends. And the thing it depends on is who are the goals for? If the goals are for me and for the patient to figure out what do they want to accomplish, that's one thing. If the goals are for the insurance company who needs to continue payment, that may be something quite different. The goals for me and the patient is going to revolve around what the patient tells me that they want to accomplish. Okay? And if it's a reasonable goal. If somebody's been in a wheelchair for years and they say, I want to run the New York Marathon, that may not be a reasonable goal. But if they say, I want to be able to stand or walk a few steps, then and they have, in my opinion, the ability to achieve those things, then those are reasonable goals, and that's what we work towards. But what's really more important is that there is a goal, that the patient is able to identify, this is what I want to accomplish. So we have an idea of what the goal, the purpose of the therapy is. If a patient comes to see me and I ask them what their goal are and they say, I want to get stronger, I'll ask them, what do you want to get stronger for? What is the purpose of your wanting to get stronger? Do you want to be able to transfer independently? Do you want to be able to walk an extra 15, 20 feet? Do you want to be able to roll over in bed? Do you want to be able to give your child a hug? The goal is what really drives the treatment that the physical therapist develops. The goal is, the treatment is a reflection of what the PT goal is. The PT and the patient will figure out what are meaningful, reasonable goals for this patient, and then the program is going to reflect those goals.
Some people with MS have such severe numbness in their feet that they can't feel the floor or even know where their feet are from moment to moment. Patrick contacted us saying that his feet constantly feel like they're asleep and he can't wake them up. It's impacting his walking, and Patrick wants to know if there's anything that he can do. So to break down Patrick's question a little bit, first, do you see this type of numbness frequently among people living with
Sure.
MS?
All the time. Very, very common. The first thing I want, when a patient tells me something like that, the first thing that I normally will do is say you feel numb. Do you actually have absent sensation, or do you just feel like there's tingling in your feet? If there's absent sensation, which is actually a little bit rarer than a profound sensation of tingling, then that's more severe. And in that case, you have to teach, as Dr. Hugo said, compensation. You have to train them to look at their feet. But in most cases, they may feel numbness, but they can actually feel it when I touch their foot. They can feel it when I move their toes. So I'm in the middle. Cinda and I are both going to brag about our research now. I'm in the middle of a program right now where we're having patients who have impaired sensation in their feet practice balance barefoot, with the idea that they're getting more sensory input through their bare foot than if they were wearing a shoe. The results are just beginning to come in. My anecdotal evidence is that it's effective. I think a lot of sensory loss that occurs in persons with MS is not necessarily due to the MS alone, but simply to the fact that they stop using their feet. They stop trying to get sensory information from their feet and use their vision instead. I believe Cinda said a few minutes ago, people are visually dominant. If they're visually dominant, that means they're not using their sensation as much. So perhaps barefoot, practicing balance barefoot makes them use their sensation more. So the loss of sensation may be largely due to the MS, but I believe there's a component of it that is simply a result of learned non-use.
We talked with Cinda about spasticity among people experiencing minimal gait difficulties. For those with more advanced difficulties, some degree of spasticity can be beneficial, particularly for people experiencing significant leg weakness. The spasticity gives their legs some rigidity, actually making it easier for them to stand, transfer, or walk. So should spasticity that may be providing benefit still be treated?
I think that's a really excellent point. There is a spectrum of spasticity. It could be from very mild to very severe. And as you completely accurately pointed out, particularly in advanced patients, it can be beneficial. They use the rigidity to stand, sometimes to even walk, sometimes to even make transfers easier. I think in terms of the treatment, the medical treatment, I've come across many patients who've told me that their physicians keep treating their spasticity too aggressively and they lose whatever benefit the spasticity gives them. I think it's important that the patient and hopefully their physical therapist has a dialogue with the physician who's treating the spasticity medically to make sure the spasticity is not fully eradicated, just tamped down enough so that it can become functional. A certain amount of spasticity can definitely be utilized functionally.
The National MS Society recently released exercise and physical activity recommendations for everyone living with MS regardless of their level of ability. How important is exercise for people with advanced MS?
Thank you for mentioning that article. I'm very proud that I was one of the co-authors of it. How important is it? Would it be too mild to say I don't think there's anything more important? Exercise, I believe, is one of the most underutilized therapeutics that could be used for persons with MS. As a physical therapist, I've been working with MS for over 30 years. It's a source of continual frustration for me that exercise programs, and particularly physical therapy programs, are not more widely used by people with MS. Not only can it address the mobility deficits, but can also be preventative in terms of keeping some deficits from progressing. There's some recent evidence that I actually heard about at the Progressive MS conference, which we were both at, which said that persons with exercise seem to have less disease activity than those who do not exercise. It is remarkably underutilized, and it's one of the reasons that I'm still very passionate about trying to give talks like this and meet patients and teach, because I don't believe persons with MS exercise enough. And I think it is a tragically underutilized modality.
Well, given those comments, what kinds of barriers to exercise or physical activity might someone living with advanced MS experience, and how can they best overcome those barriers?
I think the most prominent barrier that I come up against is not knowing what the exercise is, what exercise they should be doing. You know, they may see, some super athlete, hawking some exercise equipment on TV and say, that's what I want to do. But I think we have to treat exercise like medicine in the same way that a physician will prescribe a specific medication for a specific symptom and a specific disease. I think a physical therapist working with somebody with MS has to do the same thing. They have to prescribe a specific exercise for a specific reason, for a specific dosage to be done for a certain amount of time. And then you test to see whether the exercise was successful. If somebody comes to me and says, I need exercise, exercise will make me better. That's sort of like saying, going to a doctor and says, just give me medicine, I don't care what it is. Obviously, that makes no sense. Exercise is very specific. So Cinda was talking before about foot drop, and I agree with her 100%. Foot drop is one of the most common, in my opinion, causes of falls and gait difficulty in MS. If somebody does an exercise program where they strengthen their upper body a lot, they may become fitter. It's not going to impact their foot drop. You have to give stretching and strengthening and balance programs to address that. So exercise is very specific. So the barrier that I'm fighting the most against, I would say, is finding a therapist who will give the appropriate exercise for the patient to achieve their specific goals.
And if someone is no longer ambulatory, what types of exercise programs should they be engaged in?
I'm really glad you asked that question, because that's a very big interest of mine. First, I want to make sure that they're out of bed as much as possible, in a wheelchair, moving around. If they have the ability to move their chair at all, they should. Because they don't move, they don't get as much cardiovascular stimulus as they would otherwise. So we have to do things to make sure that their lungs and cardiovascular system are being utilized. So if you can get them to some type of upper body ergometer, anything that would get their heart rate up. Additionally, some type of breathing exercise. Persons who become sedentary as a result of advanced MS simply do not move their lungs enough. So I have, even with some of my most severely advanced MS patients, have them work a great deal on respiratory muscle strength and respiratory muscle training. I work a great deal with these patients on making sure that whoever their caregiver is knows how to stretch them appropriately to prevent contractures, make sure they have the right equipment so that they don't run into difficulties with skin breakdown. But there is no reason in my head why persons, even with the most severe MS, should stop exercising. The program that I give for my severe patients is going to be quite extensive, no more or less extensive than for my less advanced patients.
Kathy told us that she's had continuous changes in her mobility over the past year, and she's using a mobility device more and more often. Kathy wants to stay as active as possible, but she's concerned about safety, and she's wondering whether she needs to have a physical therapist physically with her in order to exercise safely.
It depends. To exercise safely, no. What a good physical therapist should do, and by good I mean someone who has training specifically in multiple sclerosis, is give them a program that they could follow at home safely and make sure that this is a program that they can do safely. The idea that you only go to physical therapy once or twice a week and see the physical therapist and you don't do exercise in the other days is really incorrect. The therapist should be the guide for your exercise program and should be advancing you or changing your program as needed. But a lot of the responsibility for exercise must lie with the patient themselves. If a program is given by the PT, the patient to follow, it is the expectation that the program will be followed. The expertise of the PT is to give a program that's specifically put together for the needs of that patient. So the short answer to Kathy's question is no, you don't need a PT with you to exercise. Your PT, however, should give you a program that you should be able to do independently.
Is there special equipment that a person with advanced mobility issues needs or can benefit from using in order to be able to participate in exercise?
There is special equipment, although it's certainly helpful, but not essential. The two immediate things that come to mind is an upper body ergometer, also just known as an arm bike. And the advantage of that is it not only gives strength and flexibility to your upper extremities, but it also works your cardiovascular system. So and you can probably get relatively inexpensive ones that you can put on a desktop for probably less than $100. There are also lots of devices that target the respiratory muscles. They provide resistance to breathing in and breathing out, and this makes your respiratory muscles work harder. That being said, many of the patients I see can't really afford fancy exercise, so it's quite doable to give them a program which doesn't require exercise. But if they have the means in one way or another, there's certainly plenty of devices that can be used.
If someone is living with advanced MS, a family member might be assisting them with exercise. What should family caregivers be thinking about when it comes to safety for themselves and their loved one when they're exercising?
I'm really glad you asked that. The safety for themselves cannot be overestimated. A lot of times when I treat a patient and there's a family member, there often comes a time where I have to end up treating both of them because the family member has injured their back or their shoulder or something. And so when I see a patient with advanced disease, I'll try as hard as I can to pull in the family member and say, this is how you transfer, this is how you do range of motion, and this is as much for the family member as the patient, because the role of the caregiver is tremendous in MS and probably sadly underestimated. And the role of the physical therapist should be not just to assist the patient, but to assist the caregiver. I don't think, in my experience, PTs have done enough to reach out and try to meet the physical therapy needs of caregivers.
Herb, your research is focused on understanding and developing interventions that result in improved mobility for people living with MS. What types of questions are you asking, and what are you learning from your research?
How many hours do we have? Okay, let me give you the elevator pitch. So we just concluded a study, and we presented it, and we're starting to write it up, where we use something that everybody knows about, but no one seems to be utilizing enough, and that's just cooling people off. We took persons with MS, these were all ambulatory patients, and we had them walk for 6 minutes, and we measured how far they walked. And then we got an inexpensive, commercially available cooling vest and had them put the cooling vest on for 30 minutes, got them nice and cold, and then said, get up and walk again. And to no one's surprise, there was a very large, statistically significant difference between the distance walked in the cooled condition as opposed to the uncooled condition. There was no exercise, no nothing. The patients didn't feel like they walked any farther, but when we showed them the difference in distance, which I believe was an average of over 100 feet per patient, they were quite surprised. So that's a very simple, easily done, but underutilized thing. The other thing that I'm very interested in is something that nowadays goes by the pseudonym HIIT for high intensity interval training. We were doing research at it in Hunter 8 or 9 years ago, and we just called it intermittent training. The idea being is that rather than exercising continuously, we take breaks in between. Cinda was talking about what she called nerve fiber fatigue, or what I would call objective fatigability. And what I believe happens there is that persons with MS, they exercise, their core temperature increases. This results in decreased conduction through demyelinated nerves, and their physical performance steadily decreases. When we ask patients to exercise intermittently, and all that really simply means is they exercise for a few minutes, then they take a break for a few minutes, then they exercise some more, then they take a break. The total dosage of exercise that they get becomes much greater when they take breaks. So we're actually, we're going to be presenting another poster at the Gait and Balance Symposium, where we asked our patients to do straight leg raises, just lie on their back and raise their leg up and down as many times as they can. But in one condition, they did it without a break. In the other condition, they took a break every, I think, 2 or 3 repetitions, just a couple seconds. When they took breaks, they could do a tremendous amount of exercise more than if they didn't take breaks. So by the simple expedient of having patients taking a break while exercising, the total dosage of exercise they get becomes larger.
How can our audience learn more about your research and perhaps even get involved if that's possible?
I'm always recruiting subjects on the National Multiple Sclerosis Society page, which talks about volunteering for studies. Several of my studies are up there. We've had, like everyone else, we've had a bit of a hard go with COVID. We've made collecting data very difficult, but it looks like we're going to be able to start collecting data at Hunter again soon. So anybody who's interested, please contact me. My work is reasonably well published, not as well as I would like, but the information is out there. I'm definitely not hiding it from anyone.
You know, you actually answered my next question within the answer of one of my earlier questions, but I actually think it's so important, I'm going to re-ask it. And the question
Please.
is improvement possible for people with advanced MS?
It depends. Generally, yes. I, by nature, am an optimist when it comes to patient care. I rarely, if ever, no, I rarely have seen patients who haven't improved, at least in some aspect. It all depends on whether they've gotten physical therapy that's really looked carefully into what's happening for them and had a careful idea of what the goals are and how to achieve them. And the reason why I'm glad you brought this up again is this really leads to a different and much larger question. For if a patient with MS is looking for a physical therapist, they should make sure they find a physical therapist who is very knowledgeable about MS. For all our MS patients who are listening today, for their MS, I doubt they would go to a dermatologist. I doubt they would go to an oncologist. They went to a neurologist who specializes in MS. For physical therapy, should be the same thing. Don't assume all physical therapists are the same. We have different specializations, different levels of expertise. So do the work, look for therapists who have the expertise. If you're seeing a therapist, ask them, how much experience do you have treating MS? If they don't, then and they're not willing to learn, then perhaps it's worth looking for somebody who does have that specialization.
Well, thanks, Herb. Now I'd like to invite Cinda to rejoin us. You both have shared a lot of really great information with us today. And I'm going to ask each of you to share the top 3 takeaways that you'd like our audience to remember. Cinda, why don't we start with you?
I think my top takeaway is to not ignore problems. Get help when you first notice something coming up, and get help to identify your best options to ameliorate that problem. Talk with your doctor, ask for a referral to a therapist. Second, I think, is stay healthy early with getting good quality sleep, getting adequate exercise, and eating a good healthy diet. And finally, my third point that I cannot emphasize enough is that functional electrical stimulation is vastly underutilized in people with MS and walking problems. Think about this functional replacement earlier rather than later if you're having any kind of walking problems. And again, consult with a physical therapist who is familiar with MS and with functional electrical stimulation to see if this is a viable option for you.
And Herb, I'll ask you the same question. Top 3 takeaways?
Do I only get 3?
It depends.
Oh, well done, sir.
Thank you.
First, I guess my main takeaway is exercise should have a goal. Saying, it's not as if you got a big bucket of exercise and they poured it all over you. Exercise needs to be specific to your specific issues. Everybody's MS presents slightly differently, and the physical therapy program, the exercise program, should be specific to your needs. The second is, even if the disease is advanced, you should at the very least be considering ways of improving your respiratory muscle strength and your cardiovascular health. I think those can not only improve your mobility, but it can also decrease the likelihood that complications can occur. The third is that don't stop exercising, regardless of the degree of advancement your disease may or may not have. Even if it's a program of respiratory muscle training, assisted stretching, sitting balance, practicing standing, the advantage of doing that over doing nothing at all is tremendous. So to reiterate, I think exercise is just a remarkably underutilized option for persons with MS, and that is regardless of where they are in the spectrum of disability due to the disease.
Well, thanks to everyone who submitted questions, and thank you, Cinda and Herb, for being with us today.
Pleasure.
You can connect with the National MS Society along with others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. I encourage you to like the posts, subscribe to the channels, and make sure that you're on the Society's mailing list so you'll continue to receive the latest information on MS and updates on upcoming programs like this one. Please remember that a recording of this webinar is going to be available at the Society's website at nationalmssociety.org/msexpert, as well as on Facebook and YouTube. I hope you'll join us again for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And I have a favor to ask each of you. Getting your feedback on today's webinar is important. So you'll see a survey pop up once we close out the webinar. Now, if you're watching on Facebook Live, you'll see a link to that survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. You know, I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is both credible and reliable. So we'd like to share some resources with you. And these are resources that you can count on to be current and credible. I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. I'll also remind you that the MS Society brings people together through peer connection programs like self-help groups, the MS Friends Helpline and Paired program, and the National MS Society's Facebook community. To learn more, please visit the Society's website at nationalmssociety.org/connections programs. Every week on the Real Talk MS podcast, I continue the conversation that we start here. So I hope you'll take a few minutes and give Real Talk MS a listen. You'll find the Real Talk MS podcast at realtalkms.com, Apple Podcast, Google Podcast, Spotify, Amazon Music, or wherever you find your favorite podcasts. Don't just ride, Bike MS. Bike MS is more than the ride of a lifetime. Whether you want to cross the finish line in person or take on a new challenge from anywhere, there's a Bike MS event that's right for you. Find out more and be sure to register at bikems.org. The Black MS Experience Virtual Summit takes place September 22nd and 23rd. The summit is an interactive experience that offers the opportunity to connect with others who understand the distinct experience of living in the Black MS community. You can get more information and register at nationalmssociety.org/BlackMSExperience. EMD Serono is a premier contributor to this event. And I'd like to close out today's program by sharing this short video that really illustrates EMD Serono's diversity, equity, and inclusion initiative.
Diversity, equity, and inclusion are critical in making a global workforce strong. We believe that a diverse workforce, paired with an inclusive company culture, strengthens innovative power and contributes to business success. That's why we are making diversity, equity, and inclusion a cornerstone of our culture.